Hello, my name is David Hanley, and I'm the dentist here at Complete Health Dentistry of the Emerald Coast. As a new patient, I want to welcome you to our practice, or if you're just coming by to check us out, thank you for your time and your interest, and hopefully we can find something to educate you with in our talks here. A little bit about my background. I'm a general dentist. I've been practicing for over 30 years now in just general and restorative dentistry, general and preventive dentistry. I was brought to the area in 1979 by my dad, who was in the military, like many people around here. Ended up going to Meigs Middle School and graduated from Choctawhatchee High School. Spent a year at OWJC, for those who remember what that is, now in Northwest Florida State. And then followed my girlfriend, who became my wife, up to Auburn University, and ended up getting my undergraduate degree from there. After that, I went to University of Alabama School of Dentistry and graduated in 1991. At that time, I came back to the local area. I came to my dentist in town, Dr. Charles Ferdon, and after a few years starting up my practice from nothing inside of his, I ended up taking over his practice. And so that's where we are now. So for 30 plus years, I've been practicing just general and preventive dentistry. And then in recent times, 2018, I was in a course, and a speaker, Dr. Mike Milligan, spoke to us about the oral systemic link, which is really what the oral bacteria in your mouth do to the rest of your body. And that changed my life in dentistry, honestly. From what I learned from there, I just knew I couldn't come back here and practice the same way. And so that's been a 5-6 year journey now that we're on, changing to what we really do now. Again, as a dentist, I'm still the same. I still practice my general and preventive type methodologies, but now we have a focus on what we call the complete health model. And what that is really, how can I maximize the health of your oral environment, your facial structures, your airway, to help maximize your total health, your total body health. And so that's really what we do. And we do that in several different ways. The first one is, again, going back to that oral microbiome. What are those oral bacteria doing? And we know there's long, standing, connections between those bacteria and systemic diseases. Anything from cardiac problems to your brain health, to Alzheimer's, some cancers. There's many different things that are known bacteria that are causative for some cases, or they make things worse. So it's like, what can we do with that? And so we have ways to kind of figure out. We know which bacteria are the bad ones. And we have somewhat simple salivary tests to do. Just a few milliliters of saliva. We can send it off and test and figure out, what bacteria are there. Again, and then what can we do with that? And so that's what we do. We have methodologies to help change that microbiome. How can we make that healthy? Anything from just our traditional, hand appliances or hand scaling, everyone say it, to deep cleanings. It depends on your need, and each case is kind of different how we focus on that. So again, anything from our hand tools to our ultrasonics. We also use any kind of home care products. We use a whole variety of home care products. We have many to choose from. We can go down kind of sort of any pathway that you choose. Again, if you're more traditional and don't mind some of the chlorine type products and those other type of traditional dentistry products, we have some of those that are really focused on these issues for us. If you're someone more of a holistic approach, we have botanical products, again, that do an extremely good job for us. Again, doing the same thing to try to help us out. So you can kind of go down whatever pathway that you would choose with that option. We also have, like I said, our ultrasonic type therapies that we use, which are really traditional. And then from there, we also offer some laser therapy as well. And that's kind of another approach to doing what we need to do to shift the microbiome. Again, other options that we have in here, other focuses, I should say, is the airway. So we are trained and educated on identifying physical signs and then structural issues too. Our physical signs are really things that we can see, and sort of anybody can pick these up. And all of us here, we're messed up because we don't see people how we used to see people. We see things all over, anywhere we're at. While we're watching TV, we're walking to the airport, or walking down the street. We see physical signs of these issues. We also have a cone beam 3D-dimensional imaging device that lets us see inside, so we can see internal structures again. That gives us clues as to something that's going on. And again, none of these clues are just 100% indicative of a problem. But again, if we see enough of these signs, then what we would recommend is some sort of a sleep screening or a sleep study to determine, are any of these physical or structural issues actually creating a problem for you? And then again, once a problem is identified, and that's the biggest thing that we do, is just trying to help educate people and help them discover if they really do have a problem. But again, if you do have a problem, and again, we'll help you on your journey, whichever journey you choose. If it's just traditional CPAP therapy, we're happy to help you with that. If you want something different, if you're just not tolerant to that, or just another approach, we offer all sorts of just dental appliances, anything from a traditional mandibular advancement appliance to epigenetic expansion appliances as well. On top of that, we offer soft tissue laser therapy. If you're a big bad snorer, or if you're sleep divorced, again, we can help with those issues. Another thing that we offer is myofunctional therapy, which is really sort of like yoga for your mouth, your face, and your oral structures. It's just trying to help train and strengthen and firm up those tissues to any way we can help, just to try to help you breathe and oxygenate your body. So if any of these things are interesting to you, give us a call and check us out, and we'll spend some more time talking about these. Thanks for your time.